So today I want us to talk about a topic that is very much requested called adenoid hypertrophy. And first of all, I need you guys to subscribe. Sawa? Hebu gonga hiyo subscription. Kuna msee ako hapa hivi ana watch na taja subscribe. Itakuwa noma, itakuwa mbaya, itakuwa noma. Haya. Adenoid hypertrophy. Kama kawaida, number one, we are going to describe the terms. What is adenoid and what is hypertrophy? Number two, we are going to discuss the normal working of the affected areas. Then number three, we look at what happens when the affected areas get the hypertrophy or when they get sick. And number four, we'll of course discuss treatment. Now, one thing to remember is that this is an ENT issue, but as a specialist myself, though in a different angle, we'll discuss about it so that you get to know what happens, what it is, how it develops, and what is expected when doing the treatment. So please subscribe so that you are able to benefit from these very useful videos. Okay? Adenoid is a soft part at the back of the nose, at the back of the nasal cavity. Let us draw somebody here, and start with the eyes, then you come to the nose, then you come to the mouth, then that is the chin, that is the neck area, and that is the head. Now this head doesn't look nice. The head looks like that. That one looks much better, right? This chin is too long, so you're going to reduce it to there. That one looks better. So here is the eyes, and is the nasal opening. So one can breathe either through the mouth or through the nose. So when you breathe through the mouth, it goes to the windpipe. And then this windpipe, which is called the trachea, divides into the bronchi, left and right, then goes into the left and right lungs, right? But you can also breathe through the nose. And the nose goes like this, then it opens at the back of the throat, like that. See that one? Good. So where are the adenoids? The adenoids are here. And where are the tonsils? The tonsils are here. You can see the tonsils through the mouth, but you cannot see the adenoids through the mouth. But this is where mucus comes. Accumulated mucus comes and drips there. Okay? So that is the anatomy. And so these are the adenoids. There are also other structures along the nasal cavity that can also get affected, but those ones we'll discuss them later on. And these are the tonsils. Both are just glands. They're just soft tissues. They're tissues that can swell when they get irritated, and the swelling can subside when the irritation goes away. Or, as we will see later in the video, certain situations can call for interventions. Okay, so we leave this guy here until we are done with our discussion. So, adenoids, we've said, are the soft tissues or the soft part. And hypertrophy. Whenever you hear this word being mentioned in medicine, it simply means a swelling. So what are we saying? We are saying that everybody has adenoids. Everybody has tonsils. Everybody has adenoids. As long as the adenoids are not swollen, then that person will just live a normal life and will not present with any complaints. But once they get swollen, once these things get swollen, there is obstruction to airflow. And this is obstruction to airflow through the nose. And this obstruction will lead to the symptoms. Okay? So, what symptoms will we expect from a person or a child who has adenoid hypertrophy? So, we are looking at a child. Number one, will have snoring. Simply because when the child breathes through the mouth and air rushes through the adenoids, which are swollen, there will be air brushing through soft tissue that are swollen, and they will start vibrating. Now, when they vibrate, you get the sound of snoring. Number two, there will be nasal blockage, as we have said, and it will be a constant nasal blockage. Number three, we will have mouth breathing. Because there is obstruction of airflow through the nose, they will choose to breathe through the mouth because it is easier to breathe through the mouth than to breathe through the nose. But breathing through the mouth will also have its own consequences, because that is not what is supposed to be happening. Breathing should be taking place through the nose and not the mouth. Then number four, there will be frothing in the mouth. What you need to understand is that most of these symptoms will be taking place at night. Why? We will look into it. So there will be frothing in the mouth. Because now they have chosen to breathe through the mouth, and there is blockage, and these things are swollen, and they are soft tissues, and they are vibrating, it will cause saliva and mucus to froth. It's just like taking a can of water and you put a straw in it and you start blowing through it. They'll just be frothing because you have saliva, you have mucus, and you have air, and you have vibration. The result is frothing. Then number five, there is a condition we call nocturnal apnea. Apnea is loss of breath. Nocturnal is at night. These children will present with the loss of breath at night. Commonly, they will sit on the bed, cry, scream, look for air. In fact, they will look like they were being choked. We are done with the symptoms. Now, let us look at this symptom number 3 and number 2 and dig deeper into it. Okay? What will mouth breathing do? What are the consequences of mouth breathing? Consequences of mouth breathing. Consequences of mouth breathing. 1. Breathing should happen through the nose for the following reasons. Air is normally warmed as it passes through the nose into the throat, and by the time it's reaching the windpipe, the air is warm. So function number 1 of the nasal cavity is to warm the air. Function number 2 is to eliminate particles in the air. Particles and microbes. When you breathe air that is dusty, the dust will get trapped in the mucus and in the hair inside your nostrils. Okay, so children don't have much hair, but they of course have a higher content of the mucus in the nasal cavity. So its purpose is to trap dust and to trap microbes, bacteria, fungi, smoke, all those things. And purpose number 3 is to humidify the air, so that by the time it is reaching the lower respiratory tract, the windpipe and the lungs, the air is already moist. So the nose plays 3 major roles. It moistens the air, it filters, and it warms the air. Okay? So filtering for particles and microbes. When breathing is happening through the mouth, all these functions are not done. So the air reaches the throat when it is cold air in the throat, and the result is irritation. The result of irritation is frequent tonsillitis and pain and discomfort. Number 2, we have air that is not filtered. So this air will come as unfiltered air. It will contain microbes plus particles. The result is the same: tonsillitis, pain, and discomfort and irritation. Number 3, you have dry air. You have dry air, and dry air will irritate the throat, cause discomfort and cause irritation and predispose to frequent tonsillitis. That is the reason why anybody who presents with frequent tonsillitis will need to be seen by an ENT to investigate the reason as to why the person is presenting with frequent tonsillitis and unending infection. Now, breathing through the mouth over a long time will make the child to develop a fish face. Okay? These structures here, the mouth will come forward like that. You see how a fish looks. The mouth is in front of the nose. And another consequence is that they develop a heavy tongue. This is because of frothing. Frothing and the tongue vibrating while they're breathing through the mouth. So the tongue just becomes heavy, and the child starts talking with a heavy tongue. Now, what causes the adenoids to be hypertrophied and the adenoids to be swollen? Number 1, these are usually children who have issues with allergies. Remember in my previous video, if you watched, we talked about this thing. Allergies will start from birth, and along the way it will present as adenoid and tonsillar hypertrophy. The adenoids will be swollen, the tonsils will be swollen because of a child who is, we say a child who is atopic. A child who has inherited genes that are responsible for allergies from the parents. Okay? So they are usually hypersensitive, just waiting for a trigger to develop the same. And usually in most cases the trigger is flu virus. So the things that are going to make it worse things that will make it worse. Number one, infections, and commonly flu and tonsillitis. Remember, when tonsillitis happens, the tonsils get swollen and there is also reduced space. So the tonsillitis makes the situation to be worse. Flu will always trigger tonsillitis and pharyngitis to occur, and it will make the situation to be worse. So that is infections. Number two, allergens like cold, dust, perfumes, smoke, paint, all those allergens. And then number three, sugars, especially sugars present in commercial drinks like sodas, sweets, carbonated drinks, commercial juices, all those things. And if you are keen enough, as you are discussing the causes and what triggers or what makes it worse, you already have come up with part of the treatment. Okay? You do not need the constant exposure to flu. Of course, there's a vaccine for that. You do not need exposure to those commercial drinks, carbonated drinks, sweet drinks, because when these drinks pass through the throat, they will just cause an inflammation. Okay? You need somebody who is able to identify triggers in the environment and taking the necessary protection, including PPEs like wearing a mask. Okay? So what are we saying? We are saying for any child between the ages of 1.5 onwards, especially most cases, we see them at the age of about 3 years. When they have just started school, a child who comes with mouth breathing, blockage, noisy breathing, snoring at night, frothing, choosing to breathe through the mouth, waking up at night for lack of breath, that is a child who is suffering from adenoid hypertrophy. Another thing, another cause, another symptom of adenoid hypertrophy that is usually asked a lot in the outpatient setting is a foul breath from the mouth. Because these things are hypertrophy, they are enlarged, they tend to trap mucus. When they trap mucus, that mucus, it's very easy for it to get infected, and when that happens, they get a foul breath. So a foul breath will start. The next thing you have a tonsillitis. You have pain in the throat, you have a feeling of choking, a sensation of choking, and they'll start vomiting and they develop a fever. So this explains why you end up with frequent tonsillitis, because these things are always trapping mucus that's very hard to treat, because that is a physical barrier or obstruction. And then as they are trapping the mucus, as the mucus is trapped, it begins to release the mucus through the throat. Okay, so it causes a foul breath. In a few days, it causes tonsillitis, you have pain and fever, and then another thing that you normally have because of this constant discharge is a night cough. Just when they have started sleeping, 1 hour after, they start developing a night cough, especially at around 11, 12 a.m. all the way to about 3, 4 p.m. And usually an irritating, dry night cough. Irritating, dry night cough. Another presentation that will happen with adenoid hypertrophy, the ears have a channel in which they drain through the throat area. So one function of that throat area is to drain the ears. Now, when there is blockage in where the ear is supposed to drain from, which is around the throat area, there is usually back pressure to the ears, and then there is pulling of exudate or whatever is supposed to come out of the ears. When these two things happen, the ears get infected. When they get infected, you have that condition called otitis media. Commonly it will present with fever, pain, vomiting, and if not treated early, will start getting a discharge out of the ears. Commonly, this happens in the age of between 1 to 2 years. And when this happens, you have constant otitis media. It is alerting us towards a hypertrophy of the adenoids or a blockage somewhere in the drainage of the ears. What happens at night? When they are asleep at night, when someone is asleep, the body rests. The heart rate can fall to as low as 40 beats per minute, because it is time for all the organs to relax and to rest, including the heart. But when these children are asleep, children who have adenoid hypertrophy, that is when they get the worst symptoms. Why? Because they will breathe in the cold air, and cold air is an irritant, and the adenoids will automatically enlarge. What is even worse is that when this is the cavity, and the adenoids are here, and they are enlarged, and the person is asleep, they tend to relax, and when they relax, they fall into the nasal cavity, and they even block the airway further. When they relax, they just become almost like flappy, and when air is rushing through it, the snoring becomes even worse. Now, when there is impediment to the flow of oxygen, when these children are asleep and there is less oxygen being delivered to the lungs, the body senses that there is less oxygen to the blood, of course. And what does it happen when you have less oxygen in the blood? It increases the heart rate. Heart rate will increase when either the oxygen levels is reduced or the demand is high. But in this case, it is the oxygen levels that is reduced. So it will increase the heart rate. So while the heart is supposed to be resting, it is instead racing. When this happens, over a prolonged period, the heart simply gets tired, because it has been racing when it's supposed to be sleeping, when it's supposed to be resting. When it's supposed to be resting, it is racing. Okay? So this constant increase in heart rate will lead to a condition in the heart called an enlarged heart. Yani, ni kama hiyo heart kila saa iko gym. So it enlarges, the muscles enlarge and becomes thicker than it's supposed to become. What is even worse is that when oxygen levels are low, the body also releases some hormones, and these hormones increase the heart rate further. One of these hormones is adrenaline. Another effect of these hormones and the increased heart rate is pulmonary hypertension. You'll find that the blood pressure from the heart to the lungs becomes high, because these hormones, they will tend to constrict those blood vessels, thereby increasing the pressure. Now, these two conditions, we are into a CVS issue, a cardiovascular system issue that was not there but has been caused by adenoid hypertrophy. it is that serious. So, because we have all these things happening, because of just some soft tissues that are swollen, that are blocking the airway, the treatment is usually first medical. However, it depends with the severity. Moderate to severe cases will require an ENT to review those cases, and most probably they might end up in theater. And the purpose is to open up the airspace. It's just to open up the airspace, open the airspace, and thereby improve breathing. Once that happens, because the procedure is usually just to reduce, to cut off some of those adenoids that are swollen and the tonsils as well. So just open up the spaces and all of those symptoms disappear. However, for the moderate cases, just require medical treatment with follow-up. And in case the situation does not improve, then a surgery is indicated. So what are we saying? If you have a child with those symptoms, they need to be seen in the hospital. Do not treat them at home and do not self-medicate. Usiseme ni homa. Have you seen how that thing can be bad? It can occur. It can just start from an issue, a respiratory issue that can be ignored, all the way to becoming a heart issue that might land you in the ward and might develop things that the baby did not even need to develop. Do not. The issues with tonsillectomy. This is the medical term for the procedure of, just trimming the adenoids and the tonsils to open up the spaces. Do not be afraid of this procedure. Do not be afraid of theater, because the consequences of adenoid hypertrophy can be worse than you can think. So that brings us to the end of that very educative video, and I'm asking, please subscribe. Please subscribe so that we are able to grow the channel. It is the only way I'm going to get encouraged to produce this and more videos. So please subscribe so that when I upload another video, you will be the first to know, the first to watch, and the first to get informed.